Hey everybody, so this is going to be my first YouTube vlog ever, so hopefully it doesn't turn out too bad. I'm doing this because I am having a breast augmentation. I'm going for an 800cc silicone, just because the reason why I chose silicone is your exposure to silicone with the silicone implants compared to the saline implants, it's going to be the same. And with the new silicone implants, it doesn't leak out like the old ones did, which the old ones they took off the market in 1996. They did some studying, and in 2006 they put the new saline on that's a stronger cohesive gel, so it doesn't break apart if the membrane gets damaged, so it doesn't leak out. Right now I am a 38B, and that's post-pregnancy. I was a 38C before my pregnancy, but after nursing and everything, everything gets deflated. So today was my consult, and today is June 26, 2015. I scheduled my surgery today for July 15th, 2015, so 2.5 weeks away. I just want to kind of touch base on some stuff. The amount for the breast augmentation that he gave me for silicone is $5,600, and that's in Destin, Florida. Dr. Ennis is going to be doing it. So he seems like a really nice doctor so far. He did surgery on my mom, and she loves him, so that's why I'm going to him. We're going to be going underneath the arm, and the implant's going to be going submuscular, so underneath the muscle. And I do want it, the 800 cc's, but he's going to make sure they're going to fit once we get into surgery. Another thing about my case, and another reason I'm posting this, is because when I was doing my research, I looked at hundreds of vlogs and read so many articles, and I really couldn't find anything about patients being on suboxone therapy. And I am currently on suboxone. I've been on suboxone for 4 years. I do plan on getting off. Just at this time in my life, I'm waiting for things to kind of calm down in my personal life. But within the year, I do plan on getting off of it. I'm on 3 films a day, and I know that's a lot. If anybody has anything negative to say, keep it to yourself. Turn it off. Turn the vlog off and move on. Don't really want to hear about it. This is just informational because I couldn't find any information about it. So I'm posting it for people who want to know. If you want to judge, move on. Thank you. Anyways, so I'm on 3 films a day, and yesterday I had a suboxone appointment and informed my suboxone doctor what was going on, that I wanted to have this surgery, and that I had my consult today. And my suboxone doctor actually used to perform breast augmentations and other plastic surgeries. So he said if the surgeon had any questions, to just give him a call. So today, found out, that they were going to be giving me Percocet 5 milligrams, 1 to 2 every 4 to 6 hours for pain. So I asked them to call my suboxone doctor, and, they had me in the room when they called, and asked, what the plan was going to be for afterwards and what to do with the suboxone. So the suboxone doctor said to stop taking my suboxone 24 hours prior to surgery, and just to take the Percocet while being treated by the plastic surgeon after the breast augmentation, and then wait 24 hours after the last Percocet to take the suboxone again, and then take it normal. The plastic surgeon's nurse was not too happy when the suboxone doctor's office said that, because she's like, you know, this Percocet's going to be like taking a Tic Tac. It's not going to work for you. So I said, well, if I'm in bad enough pain and nobody helps me, I'm just going to go to the ER. So it's kind of just wait, see, wing it. Here we go. So into the medications that they prescribe, there's 2 herbal things that they recommend that it's going to help with bruising and pain. The bromelain with quercetin. Your plastic surgeon should know what that is, or you can Google it. You take it 3 days prior to the procedure, and then continue taking it afterwards. And then Arnica montana 30 times is another supplement. Both of these are to help speed up your recovery, help with bruising. You can go online and type in helpmeheal.com. Just go to Google, type in Help Me Heal. It's going to bring up those supplements. They do not contain vitamin E. Vitamin E is a blood thinner. It's going to make you bruise more, so just stay away from vitamin E. So then this doctor prescribes Percocet for pain. Not all doctors will do that. And it's good to take a stool softener while you're taking narcotics, because they'll stop you up, which I'm sure if you take suboxone, you probably know about all that. They prescribe Zofran just for pre-surgery. They prescribe 2 Zofran pills that you have to take 1 hour prior to surgery, and then you're done with it. Then they prescribe Phenergan for nausea after surgery, and then they prescribed Neurontin, which is gabapentin. It's non-narcotic. It's actually an anti-epileptic medication, but it does help with nerve pain. So the nurse said that a lot of times people say the Neurontin helps more than the Percocet. Hopefully that's the case. So that's all the prescriptions. What was really weird out of all the research I did, everybody talked about wearing a compression bra afterwards. Like the surgeon will put you in a compression bra before they wake you up. And a lot of times they will put a bandeau around you, around the top of your breast right here. This surgeon in Destin doesn't do the compression bras. They only do the bandeaus, and you have to wear the bandeau for 1 week. No bras for 2 to 3 weeks. Let's see. And I'm trying to read some of this while we're going. And it says to stop taking all blood thinning products like aspirin, ibuprofen, Advil, Aleve, Motrin, any kind of non-steroidal anti-inflammatory drugs. And also to stop taking vitamins and herbal supplements, anything that's going to thin your blood out. Stop taking it 2 weeks prior to surgery. So, and no eating after midnight the night before surgery. And you should sleep elevated. Then for massages afterwards, yeah. So she said, the nurse said to start doing massages and stretches. Sorry, back up. Start doing stretches as soon as you get home. Don't wait till the next day. Start doing like your back stroking, like swimming, like backwards. To do that the day of. Do it as much as you can. And then 3 to 5 days after, sooner if you can, if you feel up to it. 3 to 5 days or sooner after surgery, you can start massaging. So like she said, while you're watching TV, the first set of commercials, do squeezing if you've had babies, like you're massaging your milk down. The next set of commercials, push together. And then the next set of commercials, push down, push in on your boobs. Or you can karate chop down. Karate chop down. That's how she said it. So if you have it under your arms, the protective little strip they put on your incisions can be removed after 3 days. I did ask about pain pumps for breast augmentation, since I'm on suboxone, something that's going to help, because pain pump is lidocaine. Lidocaine is the pain medicine in the pain pump. So I had it with my shoulder surgery. It just helps numb that area with the lidocaine. And it's a pump that's hooked in there, and whenever it runs out, you just pull it out yourself. I talked to the doctor about that, and with the breast augmentation, they don't do that because of risk of infection to the implants. So they're not going to do that. Let's see. Another thing we talked about. Oh yeah, the bando for 1 week. I think I mentioned that. Activity level. After 2 weeks, you should be pretty good to being back to normal. You're just still not going to have a lot of energy. Like, I have a son that's 23 months. So he said that I'm going to need help, during the 3rd week still. But after that, I should be good. Lifting, if you have anything like a child you have to lift, you have to learn a different way to lift. Like, lift with your legs. Let them crawl up on your legs to get on the stuff if your child is of that age. If they're younger and not crawling or walking, you need somebody there to help you. And also, after surgery, you have to have somebody with you the first 24 hours. And also, like, opening bottles, opening anything like that, you're going to have help, because you do not realize how often you work your pectoral muscles, which is the muscle that the implant goes under. So that's something else to think about. Try to have everything at a reasonable level to where you can kind of keep your arms at your side a little bit and just barely reach up, so you're not going, oh, okay, yeah, because it's going to hurt. So, yeah. I'm excited. I'm not really nervous about having the breast augmentation. I've been wanting it for a long time. And it's not going to affect in the future, like breastfeeding or anything like that, because it's going under the muscle. Your milk ducts and stuff are in the front. It's not affecting any of that. Or going through the armpits. They're not going to be cutting through the areola or causing scar tissue to the milk ducts. So I can breastfeed as much as I want in the future. And there is a warranty on breast implants for the silicone that I'm getting, because I think it's by Mentor. The nurse said it's like a lifetime warranty on them. And then there's a 10-year capillary contracture warranty. And there's something else you can pay like an extra $200 for. So, but yeah, right now I'm going to try to get a couple outfits together over the next 2 weeks so I can have something comfortable and loungy to wear after surgery. I did plan on just wearing like a kind of sheer jacket thing that's real thin you can see through, and then I found out that you're not going to be wearing a bra, so your stuff's going to be hanging out. So I'm going to have to rethink that. No peep shows. But, yeah, just maybe, because it's summertime in Florida, so it's super hot. So I'm thinking like maybe some kind of tube tops that are kind of real stretchy around the boobs. So anyways, I guess I will update y'all the day before surgery and let y'all know what I've done to prepare and what the surgery center says when they call. Alright, thanks for tuning in and listening.